If you want the best, 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 choose higher best.
A pleasant evening to each and everyone, especially to Cognizant Philippines. Hello, good evening, and to all our FB viewers right now. So tonight we are going to discuss tuberculosis, TB, and for what reason? Mostly this is to boost an awareness and at the same time for early detection. The sooner, the earlier that we're going to detect the tuberculosis, the spread of tuberculosis, we can actually save lives for the reason that this is one of the global health challenges and somehow leading infectious diseases in the world. So we have to find it out. We have to dig deeper and we have to know more. We have to understand more on what is TB, how do we have to what's the mode of transmission, how to prevent it, and is there a possible treatment for this one? So, on behalf of Signer Quest, good evening to each and everyone. I am Ria Kabigting and I will be discussing tuberculosis tonight. So yes, let's fight TB and let's go beyond health campaign. There you go. So our main objectives for tonight will be I actually aligned this one with World Health Organization because we need to protect our loved ones, we need to protect also ourselves. So for here we have to understand what would be the clearer concept, ideas, and how do we acquire or what's the mode of transmission of tuberculosis, who are the individuals actually who are at risk And how do we possibly is there a treat for this one? And apart from that, the stigma behind tuberculosis. So as much as possible, we have to prevent those things, and those are the ideas, those are the concepts that we will be discussing. As we can see here, there you go, tuberculosis is one of the biological hazard. It is considered a biohazard that actually targets mainly the lungs. Yes, however, it can actually spread systemically all over. It can affect all other organs, particularly our liver, the brain, and other parts of our body. So, in here, if you're going to look at this one, tuberculosis is largely preventable. Yes, preventable and a curable disease. Take note of this one. However, it still continues to cause somehow disability, a major killer, especially in some countries that are devastated, or some countries that are somehow disadvantaged communities. So part of that, we are included, Philippines is there. So we have to increase more awareness, public awareness with regards to devastating health, social, economic consequences of tuberculosis, since this is part of the epidemic issue also. So if you're going to look at this one, Dr. Robert Koch discovered Mycobacterium tuberculosis. And we are lucky because way back on the previous history, 1882, he announced the discovery of the bacteria, what we call the tuberculosis, the Mycobacterium tuberculosis. And this gave way for the diagnosis and for the cure of the disease TB. So each year, more or less, we celebrate World TB Day every March of the 24. This is to commemorate the detection or the date wherein Dr. Robert discovered the Mycobacterium tuberculosis. And during every March actually, or every TB awareness, tuberculosis awareness, this is to educate the public with regards to the impact of the tuberculosis all over the world. And we have also to partner with especially with the health workers on the prevention and the raising awareness, because this is one of the challenges that somehow hinder the progress of the progress of a country, of economic, for a reason that most individuals or somehow late detection can actually lead to death. So if we are going to look at the global impact, TB occurs in every part of the world. Yes, almost wherever you go, there is tuberculosis. It's just that on the World Health Organization, they mentioned that there's a 44% increase of cases in countries like Southeast Asian countries. And if you're going to look at this one, more or less 8 countries accounted the two-thirds of TB cases, and it's where the Philippines will come in. In our setup, Philippine setup, this is one of the leading causes also of death. And as you can see, 10 million people worldwide, globally, are actually affected or becoming ill with regards to TB. So if this one accounts 8 countries, Philippines is one, Asian countries are there, and therefore for the epidemic, the overall goal of this one is to strengthen the awareness, to ensure that proper assessment on the progress towards TB or how to end tuberculosis. And they actually make some targets regionally all over the world, and to promote, to guide, to support the analysis on the use of TB, health surveillance, particularly on our health surveillance, the medical surveillance, policy, planning, and programs should be in place. So in this one, they actually cited some cities, they begin to complete it. As you can see, 2016, on the blue collar part, they completed this one, but then planned for 2020. But then, as we all know, 2020 is one of the wherein COVID cases occurred. So there's a disruption with regards to the planning of tuberculosis. However, we are still continuously raising the awareness, raising the awareness on how to prevent the mode of transmission. So if you're going to look at this one, what would be the effect, the impact also of COVID-19 for the pandemic and tuberculosis? What's the implication? So if we're going to relate this one, as you can see, 2018, 1.49 million deaths are occurring. However, with that detection, it reduced to 50% reduction for supposed to be early detection of TB cases. As we all know, this COVID-19 affects the detection, because there are some individuals, of course, we're scared for some checkup. We don't know if we are infected or if we acquired the development of tuberculosis. So as you can see, estimated million death for 2020, it increases. So to continuously somehow check also the impact, there are some mitigation, some strategies based on the data that are reported. The reason why there are increase when it comes to death would be because of the weakened immune system. You have COVID, you are a COVID victim, probable, suspected, plus you have a weakened immune system. There you go. It's an additional issue also on the affectation with regards to TB. So with this one, they had a report with regards to the milestone and target 2020 with regards to TB. So they actually emphasize here the treatment, the preventive strategy, the research. These are, as we can see, 40 million people, 2018 to 2022, that would be the main target. And somehow on the treatment, on the detection, on the preventive, this is what they set, and this is what they're tracking and continuously tracking. And this actually came from the Global TB Report of 2019. And they're looking still that somehow a reduction with regards to the death, with regards to the mode of transmission, acquirement of tuberculosis. So if you're going to look at this one, that's for the global report. On our Philippines setup, we have here the Department Order 73 series of 2005, a guidelines with regards to the implementation of tuberculosis in workplaces. So if we are going to look also on the Philippine setup, TB is the sixth leading causes of death. Tuberculosis, that's six. Could you imagine? Because they mentioned that with regards to TB, the transmission of this one would be, it's low, and there are individuals that can be affected in a way that you don't know that you have the bacteria. However, it's not active. There are no signs and symptoms. I will be further explaining that later on. So estimated 200,000 up to 600,000 Filipinos has active TB. So when you say active TB, these are the individuals that somehow they have the signs and symptoms, compared with the latent, or we don't know that they have the germs, they have the bacteria, yet it doesn't manifest on themselves. So if we're going to look at this one, we feel here in the Philippines setup, according also to the World Health Organization, it's the ninth worldwide countries somehow were having a burden with regards to TB. So we have to really strengthen the awareness. We have really to make sure that everyone would be aware on how to prevent, that there's a cure on how to somehow address it with regards to the TB. That's a strategy, the DOTS strategy that's being implemented in the Philippines setup. So to go back with this one, with our DO, Department Order 7305, this is actually mandated to all private sectors that we have to have this prevention and control be in place in workplaces. If we're going to analyze this one, this is actually helpful. Early detection, Prevention would lead to effective treatment, and at the same time, this means that personnels, once they're treated, once they're detected that they have the tuberculosis, they can go back quickly. They can return quickly to their respective workplaces. So it's actually a win-win situation for both the company and the personnels. For what reason? We have this policy in place, early detection, then therefore they can go for the treatment and they can go back. They can go back to their workplaces right away, and that can actually increase the productivity. So the very first step that they're actually mentioning here would be the formulation of the workplace policy program. It is mandatory, as we mentioned, especially to all the private sectors, that we have to have the policy in place, approved, and at the same time supported by the management. And this should be integral part of your health and safety. Looking at this one, being part of the Health and Safety Committee members, we oversee the implementation of the TB program, of the TB policy in our workplaces. So every establishment should have to organize the program, the prevention, the medical treatment as much as possible. This should be included, the advocacy, especially the advocacy on the education, training, or how to improve also the workplaces, and it should be carried out. That's why you have your early detection, you have your medical surveillance in place as part of our requirement, especially with regards to the reporting and recording. And this should be completed. And actually, to we are submitting this one on a yearly basis because of the reporting. And again, if you're going to look at this one, it's more of really strengthening the policy that every employees, every personnel must have to be aware, oriented. The moment that they get inside the company, they have to know already that you have this policy, you have this flow, that in case you will be somehow acquiring tuberculosis, let's not let's avoid the discrimination, the social, let's avoid the stigma of discrimination, because with this one we are not allowed. Actually, TB shall not be discriminated, and this is not a reason that they will actually kick you out from a company. Instead, they will help you out. How would be the flow process? They're gonna refer you out, they're gonna refer you to our health centers in order for the detection or for the treatment that you will be given. And at the same time, they can actually also, they encourage also some flexi hours that would depend on your health status, or for the arrangement in order for you to still continue doing your task, your continue functioning, your work activity, yet you are still being productive in the area. So it's more of the responsibilities of the employer to go subject for somehow, if it's being detected, then therefore follow the flow process. And then on the employer side, it's more also of somehow referring them to the healthcare providers, referring them for the dots or the TB medications with regards if it's being diagnosed, the availability, or a workplace on the contact tracing with regards to who was with the personnel most of the time. Is there also a possibility that they acquired the particular tuberculosis diseases? So with that one, if that policy is in place in the area, then therefore let's understand, let's dig deeper. How is this being transmitted? As we all know, this is transmitted through droplet because of the nuclei release. So when I cough, sneeze, yell, or when I even talk, there's a possibility that I will be inhaling that droplets sprayed into the air. So it's more of airborne. That's how, because of the smallest particles, droplets. So there's a tendency that I will be infected if my immune system is actually weak. So tuberculosis is a bacterial infection that can be actually transmitted through inhalation. So if this is an infectious disease, therefore, we have to double check who was with me, with the close nearby, who always somehow I don't practice the proper coughing etiquette when I cough, when I sneeze, or I don't cover my mouth. There's a chance of transmission. So if that's the case, we have here the bacteria, what we call the Mycobacterium tuberculosis, that mainly attacks our lungs and stays there. It actually stays there for a period of time. So it develops for about, you could see that once you inhale that particular bacteria and your immune system is weak, the transmission will be about 3 to 4 weeks. The manifestations of the signs and symptoms will come out. Okay, so what are the signs and symptoms? As you can see here, cough more than 2 weeks, use a continuous cough for more than 2 weeks. What else? You should also be seeing like a fever, especially in the afternoon. And this fever is usually a low grade fever. And then what else? Unexplained or somehow sudden weight loss. So after 3, 4, 5, 6 weeks, you would be observing, oops, you are not somehow on diet, or you are not practicing any health habits with somehow sudden weight loss occurs suddenly. So what would you do? You have to double check. Is it a signs and symptoms of TB? You have to double check, because the others would be when you cough, the tendency, there's a blood, and night sweats, sudden night sweats at night. Normally at night the weather is cold, right? But then on your end, you are somehow perspiring, and this is what we call the night sweats. The other signs and symptoms would also be chest pain, loss of appetite, chill, fever, more or less, yeah, you're losing weight most of the time, and a cough that's continuously. So if these are the signs and symptoms, then we have to undergo the medication. We have to undergo further testing to check if these symptoms are really for tuberculosis. So if that's the case, we have to make sure, we have to emphasize that TB is curable and it's preventable. Yes, this is preventable. So this is curable and preventable. So let's not have the stigma that, oh, this tuberculosis is not somehow. Most individuals, once they found out that their colleagues are having or experiencing tuberculosis, they would say, oh, come on, let's avoid, or this, they usually discriminate that. Let's remove that stigma because this is curable. Okay. Take note also that TB is not spread through handshaking. Okay? Shared food and drinks, toothbrushes, kissing, or even touching the utensils or other surfaces in the area. They are actually loyal to the mode of transmission. So we mentioned that the mode of transmission is more or less inhalation. So tendency when you inhale, airborne, when you cough, when you sneeze, and you tendency you inhaled it, that's the mode of transmission. And these are the misconceptions that they usually say, oh, I might also be acquiring tuberculosis. These are the misconceptions. So remember, we are not going to spread tuberculosis in these instances. To include also drinking glasses, eating utensils, it's not spread. Okay? So if that's the case, once I develop the signs and symptoms, after a while, there you go. You would be observing that there are two important definitions. One of which is the TB infection, and the other one is the TB disease. They say TB infection is somehow you are actually infected, you inhale, the bacteria is within you. However, it doesn't manifest any signs and symptoms. That's why this is what they call the the latent tuberculosis. Meaning, you are infected, however, because of your immune system, they fight off, and there are no signs and symptoms. It's just within you, in yourself. It's just that it stays there for a dormant period of time, or it doesn't manifest. You don't even feel sick. But This can actually, you have a normal chest x-ray when they check on you, at the same time a negative sputum when they check on you. But then on your end, it's indicating that you are having the TB infection when they do the skin testing. It's where they detect that, oh, you've been infected. It's just that you have the strong immune system. On the other end, we have the TB disease. So when we say TB disease, you have the signs and symptoms. You usually feel sick. The bacteria is spread into your lungs, and sometimes it stays there, and maybe it's spreading also to other parts, other organs in your body. So when they do the testing, you have here the results of TB infection. It says yes, positive abnormal x-ray, and at the same time on your sputum test, it's more of a positive result, meaning the tuberculosis mycobacterium is within your sputum when you submit that to laboratories. So if this is happening, you would say when they say the latent TB, do we get healed with this one? Sometimes they would say it's just there, it's just dormant. The others, this is what they say for primary infection, meaning you are infected, but you don't have the signs and symptoms. But once you are immunocompromised, like with HIV victim, it actually restores, it actually comes out again, and the signs and symptoms will be, you will be developing already into a disease. So that's how the flow of our TB comes in. So if that's the case, we have the different testing. One of which is the tuberculin test, or what we call the PPD test. Usually they inject this on the inner forearm to check if you are infected with tuberculosis. And this is a test wherein on the latent TB, your result comes out positive. Okay. The other test would be the chest x-ray. And this chest x-ray is part also of your health medical surveillance, which is being conducted on a yearly basis. So that's your annual physical examination. And it's where we usually detect if you have somehow tuberculosis because of the granuloma or the scar within our lungs. So if that's the case, that's another test. One more test also would be the blood test. But usually, with the TB test, with the PPD test, the chest X-ray, and the blood test, the most we also have what we call the sputum test. The sputum would be, they require you, the doc is actually going to require you 3 consecutive days upon waking up in the morning, and usually this is before breakfast. So you're going to submit one sputum for this for day 1, day 2, and day 3. And once they see at least 50% of Mycobacterium tuberculosis, then that you would be moving on to the next step. They usually let you undergo another chest x-ray to check. And apart from this one, they're gonna subject you already for medications. Okay. With this, since this is being used, the PPD, there are some interpretations. So what are the different interpretations for this? As you can see, if there's more than 5, okay, 5 millimeter, you are immunocompromised. It doesn't take note, take note that with 5, 10, and 15, more than 5, 10, 15 result, the induration, the wheel became, it actually became large, the size actually is enlarged. It doesn't mean that you have an active TB. Okay, this would not say you have an active or you have the signs and symptoms already. Meaning the others may be on, especially on this one, the more than 5 millimeters, you are immunocompromised. HIV. So usually the others might be wondering why you should, if you have the tuberculosis, here comes also HIV. Because if you would remember on the previous discussion, HIV, it weakens your immune system. So if your immune system is weak, therefore you have the chance, the higher chances of acquiring tuberculosis. So with this one, if it's more than 5 millimeters, therefore HIV is positive, but it doesn't mean that it's active. Maybe you are on the latent side. It's just that you are immunocompromised. immunocompromised. Other instances, they've undergone also organ transplant, kidney transplant, right? So with those cases, everything is your system is really weak. Okay. If you say more than 10 millimeter, more or less, you've been somehow in some areas like Philippines, which had we have higher cases of TB. So maybe you are also infected. It's just that it doesn't manifest any signs and symptoms. You've been exposed to the particular bacteria. And when you say 15, okay, but then with no previous treatment, it says positive. So more than 15 millimeters based on the PPD test, it means you are positive. However, I have to emphasize, positive result does not mean you have active TB. Again, when we say active TB, these are the manifestations. Usually you are going to feel already the signs and symptoms that we mentioned earlier. You actually feel weak, sudden weight loss, night sweats, and other signs that we mentioned. So if this actually progresses for a prolonged period of time, it actually spreads to the different organs of your body. So it's systemically, it affects already. So one of which is the liver, the spine, the brain, even your eye, the kidney. That's why the others, they would be saying, oh, there's a TB in the spine, tuberculosis in the spine. Or there's a TB meningitis, something like that. So with this one, they would say because it's spread already to the different parts of your body. Okay, so if that's the mode of transmission from inhalation, therefore those are the signs and symptoms who are at risk then. So I have here the TB risk, which is type. Usually individuals who are immunocompromised, they're at risk with some illnesses, with some diseases, to include also malnutrition kids or personnels. In a geographic location, these are the individuals that somehow in areas or in countries that have high cases of TB, and of course substance abuse also with the usage of drugs. This is included to be at risk, meaning you have a higher chances also of acquiring tuberculosis. So there you go. If you are living in a crowded, tight, confined spaces because of the exposure and below the poverty line, if you would also if you would look at this one, if we're going to relate this, once they found out that you have a positive tuberculosis and it's proven through the diagnostic testing, may it be your chest x-ray, your sputum test, usually they are requiring also the family members that they have to undergo chest x-ray for the reason that they are at risk. They are living with you. Remember, the mode of transmission is more of when you cough, when you talk, when you smell, when you speak up. So it's the inhalation of the bacteria. That's why they subject all the family members to be included for testing. Again, it's for early detection. Okay. So again, what else? HIV, weakened immune system, substance abuse, and kids below 5 years old. Again, with the kids below 5 years old, their immune system still weak. That's why they are included. So if those are the cases, therefore, who should be tested? Tested with HIV, basically individuals who've been exposed to a positive tuberculosis. What else? Individuals who have young children on illegal drugs, elderly people. We have, let's not forget about them. What else? Mostly individuals who are working in a healthcare facilities, nursing homes, or in some crowded, tight spaces. So maybe one of which would be in some jail. Those areas, they must have to be included also for testing, especially if there's one personnel who actually got the result, who have a positive result with regards to TB. Okay, what else? So what would be our preventive measure? Usually we have our environmental measurement, And it's really effective in killing or inactivating the airborne. So we have here your UV, germicidal irradiation therapy, or the light. The UV light actually kills the bacteria, the tuberculosis bacteria. So as you can see, if we're going to relate that also with COVID right now, it's effective. It's really useful because with the UV light, it kills the bacteria through the radiation, and somehow um, it prevents also the spread. It inactivates it somehow. It's effective in activating our air. Okay, so good ventilation. So we have to make sure that a ventilation, proper ventilation, because the concept also of our ventilation would be there should be an airflow in an area. So a good airflow, open your door, open your window, that's having a good ventilation, sunlight, or of course wear face mask. If you know that you are positive, then therefore proper usage of face mask because of the mode of transmission again. So now, again, with COVID cases and TB, it's really helpful. You are wearing your face mask to prevent the airborne, which is the tuberculosis, and also the COVID, right? So it's more of it's a dual purpose, not just a COVID, airborne, dust, and some other biological hazards that we are somehow preventing for the transmission. So another preventive measurement is the BCG vaccine. This is usually given at birth for the newly born infant, for the reason that this actually prevents also the develop prevents it's a vaccine, so it's a preventive strategy, prevention for the acquirement of tuberculosis, but that doesn't mean that you will not be infected or you will not be exposed already. Still, we have the mode of transmission, so it's just preventing the possible complications in case. So this is very useful also, that we have to make sure that all infants or newly born should undergo the BCG vaccination at birth. Okay, so those are the preventive strategies. And as you can see here, we have here also, based on the World Health Organization, expanding the access to tuberculosis on the treatment. 36% people were actually newly enrolled with the HIV care and started on the TB treatment. So these two usually goes hand in hand for the reason that they are both immunocompromised. Okay. And for here, I also grabbed this from the World Health Organization. It's more of triaging, early detection, isolation once they know, they found out that you are infected. So may it be positive. Once you have the positive result, we have to undergo the treatment, the necessary, the important treatment that is needed. And you have to make sure that your ventilations are in place at home or in your respective workplaces. Okay. What else? Get enough sleep, personal hygiene, fruits, veggies, immunizations, and of course, drink a lot of water. And when they say get enough sleep for an adult, you have to make sure that you are somehow getting 7 to 8 hours of sleep. And when you're going to sneeze, cough, we have to follow the cough etiquette. With the cough etiquette, don't cough using your hand, because there's the high chance that you will be spreading the bacteria. Instead, they advise that you must have to cough into your sleeve or into your elbow. Coughing into your coughing into your elbow would actually prevent spread, and at the same time turn away with the people whenever you want to cough, to avoid again the airborne droplet. And we have here the facts, the fun facts, or the fast fact that we're mentioning when it comes to coughing etiquette. Usually within 20 seconds, this is the amount of time that it should take you to wash your hands. Just in case you've covered, use your hands to cover, or when you cough, use it. You have to go right away to the sink and wash your hands within 20 seconds. And make sure that you have to maintain again the 6 meter distance with your colleague. And another fact, one out of five number of people, actually they don't wash their hands after coughing. And I would agree with that one. Most of the time, if you are too busy doing your task, doing your activity, you tend to forget that, oops, you have to wash your hand. So that's 1 out of 5. Those are the facts that they mentioned. So we have to practice the proper etiquette. By the way, they also mentioned, they also encourage that whenever you cough, you have to use your hanky or your tissue. Tissue is advisable for the reason that you can directly dispose this in a receptacle with bin with receptacle. So that's what they advise. So at least you don't have to keep on transferring. I mean, it's not just there. Instead, we have to dispose it immediately. Okay. If those are the preventive strategy, we have also here the TB dots or the medication. And this is accessible, especially in our healthcare system, healthcare area, municipality, clinic areas. Okay. We say dots. What's the dots for? This is actually a comprehensive strategy organized, endorsed by the World Health Organization. That dot is the directly observed treatment. Meaning, when you go to your clinic or when you go to some health centers, they're going to give you the medication and they're going to check if you've swallowed it. So it's a direct observation. For what reason? This is for compliance, to avoid the drug resistance. Because there are some individuals, you tend to take 4 or 5 medications for the different time, the others get confused. So when you get confused, you forget one medication and the development of drug resistance is there. So once drug resistance is developed, another failure also that oops, the TB cannot be cured, or you will be needing a higher type of medication, or more of higher doses, or not doses, more of stringent other medication that they will be giving to you. So if this is the DOT medication, which is being practiced internationally, not just in the Philippines setup, it's more of direct observation. So what are the different types of medication that they usually give? Okay, these medications, I would be mentioning them, but then of course you have to make sure that you have to consult your medical doctors on what their advice is on how you're going to take the medication. Are you going to take this for 6 months or for 9 months? The others, they take it for 9 months if the tuberculosis is really worse. If they are these are really on the worst scenario. Okay, some medications, one of which would be pyrazinamide. And what's the effect of this one? It kills the bacteria. It kills the Mycobacterium tuberculosis. So we have to make sure that since the patients, there's an increase with the adverse effect, the effect of this medication can actually increase the levels of your uric acid. So if this is the one, they usually test you. They have to check also on your uric acid. As we all know, uric acid can increase the chance also for gout. So this is one that they are monitoring if you are taking this type of medication. And of course, it's a GI upset. So we have, when you say GI upset, it irritates your stomach. So you have to take it with food. That's one medication. The other one is the ethambutol. So this actually prevents also the spread of bacteria, or preventing the reproduction of the Mycobacterium tuberculosis. So the important thing here that we have to check would be if you are having problem with regards to your vision, to your eye. So because the affectation with the for prolonged intake of ethambutol also would be vision changes, somehow blurry or blurry changes. You have to make sure that you have to consult again your medical doctors. And of course, and the other thing would be the numbness in your extremities. So that's it. What else? Rifampicin, don't get the others might react once they see that when they go for urination, they might observe some color stain or some yellow or red, orange or reddish type of fluids, or when you urinate, that's what you observe. So that's fine. That's part also because of the medication that you are taking in. It's just that you have to increase your fluid intake, because the for rifampicin, this is another one that kills bacteria. So more of increasing fluid intake. So the others might be, oh shucks, why whenever I urinate, the color is orange or somehow reddish to orange. Therefore, increase your fluid intake. And what are they checking here? It's more of, you have also to inform your medical doctors if you are taking in some birth control medications, because the effectivity of this one will become less if you are taking in rifampicin. So some advise your medical doctor, so they would be giving you some other options, or to give you more um, additional advices because of the less effectivity of your birth control medications. So of course, you have also to avoid sunlight, because one effect of rifampicin is sunburn on your end. Okay. And one more thing, the isoniazid, this actually kills bacteria and stop its growth. As you can see, this is how strong the Mycobacterium tuberculosis, right? All the medications actually kills or prevents the growth of the bacteria. So with the isoniazid, what are we going to look at? It's more of the numbness and tingling sensation that you will be feeling. So increase also the vitamin B6 level on your end. So you have to take supplements. Take supplements to increase, to prevent the numbness and tingling sensation in your extremities. Okay. And of course, you have the streptomycin. The important thing here also, you have to monitor your hearing. The others, they would be saying, I have a ringing on my ear. So if that's the case, it's more of monitoring. Again, go back to your medical doctor, because that's one effect also of your medication. So taking in all the medication, usually these are our TB dots, ripes, may it be rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. It should come from your medical doctor. You have to follow strictly the time of medication, on what are you going to take on a daily basis, on how often are you going to take it, may it be 2 times, 3 times, because we are just avoiding again the um, uh, possible complication, which is more of the drug resistance. Because if we develop the drug resistance, we will be requiring another higher version of your medication. Okay, so with that one, that's for the medication. We have points to remember here. It's more of avoid the stigma, because this is preventable. We have the BCG vaccination, and it's curable. You have your TB dots, and at the same time, the medications being given by your doctor. Once it's being treated early, once it's being early detection, so the proper treatment will be given to you early. Okay? So avoid also the following: discrimination to colleagues. Instead, we have to help them out. We have to help them out. They can go to the health centers. Anyway, the medications are free as part of our health programs in the Philippines setup. Okay, so more or less, tuberculosis also is a top infectious diseases. However, we have to give more awareness to each and every one, that we can actually stop this one. Okay, so with this one, what do we have to expect? It's more of helping one another. So if the others might be asking, if we undergone the medication, are we going to be cured? Yes, given that you're going to comply with the regimen, with the medication regimen that they've advised you. So how would we know? How would we know that somehow we are developing already the positive effect of the medications, or the Mycobacterium tuberculosis is somehow not in our system? These are the individuals. These are the three points that they usually mention is more of 3 weeks after medication, you are not already non-communicable. So that's why the doctors usually, when they give you medication, they would even say you have to take the medication first before going back to your respective workplaces. For what reason? To avoid the possible infection. At least the medication's gonna work on you first before you get back to your workplaces. Next, at least 3 successive negative sputum. So when they're going to check again your sputum test, it comes out to be negative result. So in that way, you are non-communicable. And of course, following the course period of your treatment, may it be 6 to 9 months and the long course 9 to 12 months. This is more of for the individuals for the late detection. Okay. So with that one, that's how that is tuberculosis. So we have to help one another to prevent also the spread, and let's continue to spread the campaign on the tuberculosis awareness, not just part of our requirement in the workplaces. Instead, we have to help out individuals, our loved ones, to prevent the spread. All right, to prevent the spread of TB. So with this one, let's all enjoy our holidays with the free COVID and at the same time free tuberculosis. So on behalf of Signer Quest and to Cognizant Philippines, we wish you a happy new year and a safe 2021. So stay safe, a pleasant evening, and good night.